crisis, upending lives and livelihoods while exacerbating longstanding inequities in our most vulnerable communities. We lost 35,000 of our neighbors and loved ones, 900,000 jobs, and thousands of businesses. The devastation wrought from the pandemic will be felt for generations to come. And even as we start the long road to recovery, the highly contagious Delta variant is looming very large. We must be prepared for the next public health emergency because there will be a next one, and it may be sooner than we all think. Back in May of last year, while we were battling the first COVID wave, our office launched an investigation into the city's handling of this crisis. We approached this with an open mind to learn about what went wrong, what went right, and how we can be better prepared for the future. Unfortunately, the city stalled and refused to submit the necessary documents and witnesses, so our investigation is still ongoing as of today. But I can say that we will persist as long as I'm the city's controller, and I will certainly recommend that the next controller continue this important work as well. And just last week, the Appellate Division affirmed our authority to conduct this investigation. That's my job as city's watchdog. What we found was that the city's initial response to COVID was hampered by a lack of planning, coordination, and preparedness across city government. First, we discovered at the outset of the COVID-19 threat, the city did not have a complete citywide operational plan for responding to a pandemic. The city had started making plans as early as 2006 when Mike Bloomberg was mayor. But all of these plans were either incomplete, out of date, or lacking operational guidance. Even after the 2001 H1N1 swine flu pandemic and the 2014 Ebola pandemic, the city did not finalize a citywide pandemic plan. So in January 2020, when city officials searched for guidance on how to respond to COVID, the best they had was a draft plan from 2013, a plan that was never finished and hadn't been updated for 7 years. This 2013 plan was incomplete in several critical areas, including supply chain management, the distribution of antivirals, triggers for school closures, infection control training, pandemic-related materials for healthcare professionals, and more. All of this was incomplete. Despite being incomplete in these areas, this plan was never revised or expanded after June 2013. A high-level DOH-MH official we interviewed for this investigation describes the 2013 plan as, quote, not particularly useful, end quote, precisely because it was so incomplete. But this is what the city was relying on for its 2020 pandemic response. And we all bore witness to the resulting confusion and disorganization. We also found that citywide operational planning for a moderate to severe COVID-19 outbreak was delayed. In a January 2020 press conference, Mayor de Blasio himself stressed the importance of acting swiftly and decisively in public health emergencies, saying the Ebola epidemic taught us to assume the worst and take it seriously. In January 2020, that same month, the CDC alerted the city to the growing threat of COVID-19. But testimonials and documents in our investigation show that the city did not even start citywide planning for a moderate to severe outbreak until late February 2020. In fact, in February, city agencies were discussing whether they should begin planning for the worst-case scenario. And serious interagency planning efforts didn't even start until sometime in early March. As a result, Key planning efforts, planning for surge hospital capacity, sheltering vulnerable populations, and for a citywide shutdown, dragged weeks into the COVID crisis. By then, the city had thousands of confirmed COVID-19 cases. The city did not adequately collect data about available emergency resources prior to the pandemic. That means we didn't even have an accurate figure for the number of available beds in the city at any given time. We also didn't have information about the amount and location of PPE owned by the city, including precious N95 masks. Our investigation found that city agencies had to be individually surveyed to determine how many N95 masks it owned, only to discover that the city had allowed its entire supply of over 100,000 surgical N95s to expire years earlier. New Yorkers who were here to remember, this is when PPE was at its shortest supply, as healthcare workers were forced to ration and reuse supplies. We stored 100,000 N95 masks that were useless and expired. We also found persistent confusion about agency roles, responsibilities, and chain of command in the city's pandemic response. Internal emails and communications show that the New York City Emergency Management repeatedly and incorrectly asserted that it was leading the city's COVID response efforts, when in fact the city's health department was in charge. Emails also show that the health department, FDNY, and NYPD were all excluded from key decision-making, leading to a lot of miscommunication and confusion when time was most of the essence. Without a doubt, when the pandemic came to the city did not have the arsenal needed to be prepared to fight back. But these are all issues that the city can and must address to be ready for the next emergency. We must finally create and complete and regularly update a citywide operational plan for future pandemics. It must be the blueprint across all agencies. It's time to conduct a thorough review of the city's emergency planning and develop and update all operational plans for pandemics and other public health threats. We should always make sure our stockpile of critical supplies like N95 masks and other PPE are at the ready and have systems to track and procure these vital resources. The city needs to distribute and improve its data collection and distribution systems to make sure that decision makers have all the information needed to respond to fast-moving emergencies, whatever they may be. Data is crucial to preparing for and responding to what will be the next public health emergency. It's also time to conduct a review of the city's emergency management agency to make sure it has the capacity, capability, and authority to fulfill its charter-mandated duties. That means clarifying NYSEM's role in emergency responses and providing them with the resources and authority needed to fulfill their important work in our cross-agency arsenal. We will never forget who and what we lost, and we cannot erase the mistakes of the past. But we can make sure that we are better prepared for future public health emergencies and the next pandemic. That means making sure we have completed citywide operational plans in place. It means assuring we have sufficient staff, supplies, and equipment to execute those plans. We need to make sure that we are going over a planning process, because what we found in the 2013 operations protocols, if you want to call them that, they were very aspirational. They identified some of the challenges, right, Marjorie, in the pandemic. But there was no follow-through. So when you look at what happened with school closings, you understand that schools closed too late, opened too soon. But those identifiable issues in a pandemic were there for all to see and deal with back in 2013. We never had to go through this up and down process that ended up confusing parents and putting so many people at risk. So today I am calling on Mayor de Blasio to provide our office and the public with the documentation, witnesses, and information we need to complete this investigation rather than continue a lengthy court battle. That is what good government is all about. We're all on the same side here. I urge the mayor to help us by answering vital questions. This is not about only today. This is actually about tomorrow. It's about the next mayor and the next challenges that we face. And in order to get this right, it is our fiduciary responsibility as mayor, as controller, to make sure that we give every data point, every operational tool to the people who will run our city government for the next 4 years. This is about saving lives, this is about saving businesses, and this is also about looking in the eye to the tens of thousands of families who lost loved ones, who have asked questions about what the city knew, what did the city do about it. We've asked Trump these questions. We've asked Cuomo these questions. We cannot fail to ask our mayor and our city government the same questions. And with that, I want to thank Marjorie. I want to thank NASA. I want to thank our audit and investigations team who got this report finished under very trying circumstances. And I'm very proud to be here with all of you today. And with that, we'll take any questions that any of you may have.
Mr. Controller, you did not mention the nursing homes or state response. And one of the things Mayor Blasio has been saying is you're too focused on what the city has done. He was trying to do shelter in place and put in more aggressive practices, but it was the state that was preventing him from doing it. What is your response to that?
Well, I don't think, you can kick the bucket up to Albany, but the buck and the bucket stops at City Hall as well. And so rather than deflect and highlight the real issues in the city, in the state, you also have to own what you could have done. And at the very least, what our report shows is you had a report in 2013 or going back to 2006 before you were mayor, and it was incomplete. And then Ebola came. And by your own admission, you realized that we got to do better here, and we have to prepare for worst-case scenarios. And then for 7 years or 6 years, 6.5 years, they didn't plan for anything, which is so typical of this administration. And now we don't have a planning document or planning process, and we're not learning from these issues because you're refusing to release all the documents. So yeah, you could go criticize Cuomo. I got no problem with that. But don't think that you're going to wiggle out of making sure that we have every document we need so that we can provide the next leadership of the city with critical information in terms of response, in terms of what this pandemic wrought. This pandemic, we were warned in January. We were still trying to figure out the operations in March. Just start with that timeline, and that's on the city. Katie?
So that timeline, January to March, what did you find the city was doing? I guess from the outside, it looked like there's a little bit of dithering going on in the part of the mayor of what to do and how to prepare and what the response was. So through your investigation, what was the city doing, I guess, between January when they were warning about what COVID could be and March 17th or so?
Look, I think, I'm not going to suggest they sat and did nothing. That's not true. Right? I think it's fair to say that they were getting themselves up and running and trying to meet a very difficult challenge. And by the way, let's also honor and remember the lives that were lost, whether you were a teacher or a first responder, We had people from grocery workers to first responders leaving their homes with no masks, no PPE equipment. Katie, they were out in the field. They were saving lives, nurses and doctors. They did not know whether they were going to see their own children again, and many of them didn't. So nobody failed to respond. The critique here, which is very serious, is we did not have an operational plan to guide us through some of the critical decision-making government would have to make. We didn't have a real understanding of what the supply chain was. We didn't understand our hospital capacity. We didn't understand so many points of entry here. And it's clear from the emails that a whole lot of people were talking that they were in charge, and in many different areas, we did not really have a chain of command. We need to broaden this investigation further because of the lives that were lost, because of the challenges that we had. And this is, again, a preliminary report. This is not the whole story. This is the beginning of what I hope will be a full-fledged, honest conversation with New Yorkers and with operational personnel in the city about emergency response. Sir?
Keep bringing up that we didn't know what the assets were in the city, and that one of the big failures was the failure of knowing what the city's hospital capacity was. Private hospitals are regulated by the state. The city only has control over the public hospital system. Is that sort of bifurcation of responsibility what led to that disconnect?
Look, we could do a whole we could do a whole investigation of what went wrong with the state response. Yeah. And that's well documented, and that's under federal investigation, and the Attorney General is also investigating. You know, my responsibility and my jurisdiction is the city beat, but there's no question that there was. I mean, I think any New Yorker would agree that the mayor and the governor, or the soon-to-be former governor, were operating at cross purposes. But I think there's a lot that the city could have done to know what inventory was, to know what our bed capacity is. It starts with picking up a phone and saying, what do we got here? And it also is about identifying people in an emergency plan that you go to, that you update. And look, we're not new to these crises. And I don't think it only falls on Mayor de Blasio. You know, those of us who were here in 2000, after 9/11, knew that we had to have a better response. Those of us who dealt with the Hurricane Sandy knew we needed a better response. Ebola was another wake-up call. And here we are in the same place right now without emergency protocols that should be true, that should be best practices in the country.
I think we all remember the press conferences from early March where it seemed like the administration has sort of talked itself into a place of March 1st, March 2nd, where they didn't believe it could happen here. Talk about, having warnings in January and no real action until early March. How much of that was driven by the fact that it appeared the administration didn't simply believe it could happen here the same way it had happened in China, the same way it had happened in Italy?
It's a very. I'm going to let Marjorie. I'll give you my opinion, but I want Marjorie to sort of, if you could just give him that sort of that critical timeline that the investigation was able to showcase, because I think you're getting to something that's at the heart of this.
Yeah, what we could see was a lot of activity from the individual agencies where the city did give us information. So we had a window into emergency management, and we could see very clearly from that a lot of activity. But we also saw activity at cross purposes. That is, there were agencies working themselves but desperately trying to get more information. So that's where we see a lack of data, a lack of coordination, not having clear guidance as to who's in charge, repeatedly saying one agency is in charge, then the other agency is in charge. There are, indications that agencies were cut out along the way of receiving information. And information's key. So while each agency might have been working, and was, as far as we can tell, heroically, 24/7, trying to do what they needed to do to save lives and help the people of the city, at the same time, it's the lack of coordination. And we could see that taking a while through the emails that we were provided, through the interviews that we were able to conduct, that it took a while for that coordination to begin to gel. Now we need to plan for a citywide response as opposed to an individual siloed agency response. And that's what was going on from our vantage point from what the city provided to us between, January and early March.
And that was because City Hall wasn't engaging as forced to role play together, or?
We can't see a because, we can see a what. And the what was, there wasn't interaction in critical areas, there was missing data, missing information, particularly hospital beds, amount of PPE, where it was located. We could see there was a lot of effort and very little information, and where every day counted, that's critical. So if they didn't have to spend all that time trying to find basic information, other things might have been able to be done.
I believe, based on this report, if there had been an operational plan in place, where if experts had already come in and talked about best practices, if we had looked around the world to people who had great experience in this issue, and we had that ready to go, I do believe we would have had a quicker response in January, and we would not have been fumbling around agency to agency like we did. And I think the mayor's press conferences and the governor's press conferences, I think they didn't understand that they were not soothing, because the backup to what was happening in the streets, the ambulances that people heard, the loss of life in every family, this was not a city that was coming to terms with the greatest pandemic since 1918. Anybody? Gloria, hi.
Hi. Can you talk about the documents or any other things that you haven't been able to get from the city yet, and sort of where that process is, and how your inability to get those documents hampered this report, which I understand you're calling preliminary, basically. What happens next, and do we have a complete picture of what went on without those documents?
So let me start with legal. Nasa, if you could come up and just talk about where we are in the case, and then we'll let Margie talk about the document.
Thank you. Good morning. So the appellate division spoke very clearly last week. The comptroller has the authority to conduct this investigation, and remanded to the Supreme Court, the lower court, the opportunity for us to attain a privilege log, an in-camera review for certain mayoral and deputy mayoral communications. We are calling today for the city to immediately turn over the remaining documents that wouldn't be subject to this in-camera review. We really want to avoid continuing to cost taxpayer dollars for something that the city should be able to turn over without judicial intervention.
So are you talking about emails, that kind of thing?
Emails and internal communications, reports, plans, all of that, basic information. The key thing for us is that we received absolutely nothing from Health and Hospitals. The city refused to produce it. We received one single document from the Department of Health, two rather critical agencies with regard to the response to the pandemic, and nothing from City Hall. Nothing other than what came through as to emergency management or fire, the two agencies. They did purport to give us complete productions. So we have a window. We do not at all have a complete window, and there's a lot more work to be done. And the court made it clear we're entitled to all of that, except, as our counsel says, with a small exception related to mayor's communications, and we can go back to court on that. But we're very hopeful the city will now give us all of those records they've withheld all this time from us.
And I just want to say, the mayor has a choice. He can take advice from the Cuomo administration and fail to be forthcoming, or he can turn the page and talk directly to the people of New York City through this investigation and say, here's what I got. I got good things, I got bad things, but I'm giving you everything so that we're never in this position again. And this is up to the mayor. We're going to do our work, and I believe the next controller will continue any court action necessary. But it would be a lot easier if he simply came clean and said, look, this is what happened, and this is how we're going to make it better, and we'll work with him on that.
Can I just ask you, Comptroller, how much do you think this was a failure of leadership style, if you will, you know, what we know about the mayor's style and his leadership and management style over the last few years, and also the fact that this was an event that really took everyone by surprise, including the medical experts, and that it took a lot of people a while to really catch up and figure out how to properly respond.
We said at the outset of this investigation, we wanted to look at what went wrong, but also we wanted to look at what went right. And a lot went right during this time period. And it really started on the ground from so many people who, despite not having tools, used their New York ingenuity, their New York courage to go out and save lives. And that is being documented. The press has done an amazing job telling those stories of the heroes or the sheroes who did this. You know, I always say to the persons who took my own mom from her bedroom to the hospital, I don't know who those heroes were, but they made her comfortable. They got her into the hospital. I don't know if they had PPE. I don't know if they had masks. But to me, they're going to be the unknown hero in my family. There's tens of thousands of people like that, and we have to honor them, and we also have to look at the role that they played here under difficult times. So I think that's a story in and of itself. We're not trying to bring people down. We're actually trying to deliver an emergency management plan that the next mayor and the next mayor after that and the next mayor after that can continue to revise it, to add to it, to build to it, because I do think the best place to live in this country is going to be in big cities who can do the big work, whatever comes our way. And New York has seen this every 10 or 15 years.
Mr. Comptroller, I wanted to follow up on Gloria's question. The private hospitals had a lot of plans around emergency management. They go through a lot of these drills, but still they were just as badly hit as the public hospitals. And just to kind of follow up on her question, specifically around de Blasio's leadership, do you feel like there were issues that, like, he specifically, because of politics, wasn't able to accomplish? Or, I mean...
Look, I think this report is a very serious document about management failures and the lack of a plan and a planning process that could have gone a long way to helping in our greatest hour of need. That is what our focus is, today, and to try to get that out. It would be, I think, strong to answer some more of these questions. We need more documents. We need more data. And we're going to try to get as much of it in place, Amanda, as I can.
Real quick.
I'm
Put it
sorry.
into context in terms of the city not being responsive. You do, whatever, 5, 10, 20 audits a year. Usually you're up here
We do
saying,
more than that.
however many you do.
You don't
daily
cover
audits.
all of them.
Yes. But typically you're saying, and my thanks to the city, they've already been responsive. My thanks to the city, that it's in the index.
I'm sorry, what? Oh,
What I'm getting at is, how unusual is it for the city to not turn over a single document from health and hospitals? Is this something you've never seen before? Do they stonewall a lot? Are they legally allowed to stonewall?
look, you have more stories than I do about foils that never were answered, documents never turned over. The fact that we are in court right now because the mayor is trying to stop our office from doing our charter mandated responsibilities is outrageous. The fact that we are being stonewalled, Nixon style, because all we're trying to get at is answers to the greatest pandemic in 100 years, and they don't think they have to account for anything, is simply outrageous and acceptable. And New Yorkers who lost their parents and grandparents should be outraged by this, okay? I mean, it's nice to go, to a concert and get on stage, but man, why don't you just tell us what happened? That's what New Yorkers want. It's time. It's just time to answer these questions, because look what's coming. We got Delta coming. We got school starting. We have a lot of unanswered questions. We have people who don't want to get a vaccine. All of these issues are very serious, and I think we need to have some understanding of what went on, and that's what we're trying to do here today. We're not trying to tear them down. And by the way, I will say, the mayor, has worked very hard during this pandemic. The city has done a lot of good things, as Marjorie said, agency heads. But we have a job to do here. We've got to tell this story in the same way that we need to hear the nursing home story through the investigation of Attorney General James and whatever the U.S. Attorney's Office will bring. We also need to have our own reckoning in our city government.
You had mentioned that there was some confusion where Office of Emergency Management thought that they were in charge, but it was actually the health department. I guess we could see it in the report, but can you talk a little bit more about that confusion? Were they kept out of important decision-making, and was that a surprise that the health department would be put in charge? Obviously not of the health aspect, but other things.
What we can glean from the documents, and Marjorie, correct me if I'm wrong, is that there was some people were in a working group, then some people weren't. Some were included, others weren't. Is that a fair? Would you want to? Yeah.
Yeah. I mean, what we saw most clearly was organizational plans early on saying who is in charge, and emergency management putting themselves in charge, and health correcting emergency management and putting itself in charge. And that happens more than one time. This is, again, very early on. And at the same time, we see various points where the agencies are trying to communicate with each other. One is not following the other's directions. So where you have an unclear chain of command, that results in delay. We know that every day counted. People were working hard, but the lack of planning appears to have had an impact in and of itself. It couldn't have not, particularly where we see that confusion going back and forth, and at various points, key agencies not being included.
By the way, if you speak to Hazel or Amy, we'll get you the emails or any documentation we have through our normal channels.
In your remarks, you kept circling back to this exploration of 100,000 and 90,000 masks. Health and hospitals alone is like 50,000 employees. So even if all those masks were good, we're talking about a 2-day supply of masks. So in your mind, what's the greater sin? The fact the city only had these 100,000 masks, or the fact that these masks were all gone?
You can sin more than once. I think it was real. I think when they opened up the closet and realized what they were dealing with, I think that's why we're stressing, and I'll stress this 100 times between now and December, we have got to have an emergency plan that is constantly revised, constantly updated. We have to know what our assets are. And by the way, it's not just about COVID. It's about a whole host of tabletops of things that could hit this city. Obviously, we're dealing with variants now, but we need to spend more time and energy doing the emergency management work that we hope we never have to implement. But as I've seen as a New Yorker and as someone in government, we tend to have these emergencies in New York City more than we realize. And I think it's time to give the resources to that. And by the way, it takes many forms. One of the compelling parts of the investigation when Marjorie and the team were briefing me was that there's something like 13 different plans out there that could be considered an emergency planning process. But there's no central plan. And then when we finally found the central plan that goes back to 2013, never revised for 7 years, identifying all the possible issues that could be found in a pandemic, and nobody going out and making sure that we're whole in each of these bucket of areas of concern, including school closing and school opening, which many of you have reported on over the course of the pandemic, only to find out that schools were an issue going back to 2013. So it's time now to actually create a plan. I think it's going to be too late for this mayor to do that plan, but the next mayor must be committed to doing that, and that is why I am here today demanding that every ounce of energy has to be to create a whole real picture so we can actually build out a new, so the new NISM commissioner rather, will have a full understanding of what happens on January 1st. All right. All right, everybody. Thank you all for coming.
Individual topic?
Sure.
You mentioned Cuomo. I was curious if you agreed with his decision not to bring forward articles of impeachment.
I think an impeachment process is warranted. I think the Assembly report is also warranted. Again, this is not about piling on. This is about making sure that things never happen again. In my line of work as controller, an ounce of prevention's worth a pound of cure. And I think that has to sort of be the model for some of these crises, whether in Albany or New York City.
And then my follow-up question is, do you have any plans to run for state seats?
I'm busy. But I expect, as I've said, to be very active in the political life of the city, and I'm excited about that. I love this town, and I've been very privileged to be able to do this work, and the work that we have. We still have 4 months of work and some very serious investigations that we're going to be releasing to all of you, and I ask you to take a look at them. And the staff here is working very hard under difficult circumstances. Thank you, everybody. Be safe. Good job.